It's a
Okay,
privilege.
everybody.
It's a
Hi,
privilege to be
everybody.
here
Thanks
tonight.
for joining us on Tuesday evening. We have our special guest for our deep dive tonight. We have Dr. Roger Lee, a retired oncologist-gynecologist. And I just have to say, this man is very near and dear to my heart. Had this man not come into my life when I was in health crisis 25 years ago, I would not be a proud mom of two boys. I was ready to lose my uterus due to fibroids. This man saved them. Not the fibroids, my uterus so I could have my kids, right? And it's not often that we get to repay the doctors that make a difference in our lives, but I do believe by my mom sharing this with Roger and then me doing the follow-up, I do believe we are making his life better, and he's going to tell you his story. And I'm so honored to have you, Roger. So thank you. Thank you for being you, and thank you for doing all that you have done for all the other people in this world. And I'm going to turn it over to you.
Thank you, Tracy. As I was saying, I'm so privileged to be here tonight, and I'm kind of excited. Last week I only spoke for 10 minutes, but you have given me 1 hour to explain things that I think everybody listening should know. And then I will tell you my journey with the LifeWave patches, which is kind of amazing, but I'm still on the journey. I haven't
Yeah.
reached the final end yet to find out how well it's working, but it's working. So I
And
want
be
to share that with you. Thank
perfect.
you
And
for,
before you really get going, I just want to mention, so the 1 hour was our total call. We already used 30 minutes. So really it's more like 30, 35
oh
minutes.
my God. Okay, I got to talk fast. Okay, very briefly, my little biography about myself. I was born in 1941, so I'm 84 years old, and I spent most of my time in Los Angeles growing up. Went to UCLA for 2 years. Graduated from Stanford University with a BA in biology. Went to USC Pharmacy School where I met my wife Sylvia, and we got married in 1966 when she got her bachelor's in Spanish, and she got two bachelors the same month. We make a big joke about that. Anyway, so after that, um, after medical school, I went into the Army, served 20 years in the military, got all my training at Walter Reed Army Medical Center. And my last assignment was here at Fort Lewis Madigan Army Medical Center, where I served as chief of gynecologic oncology. After retirement, I taught at the University of Washington for 2 years. And then I private practice, 22 years in Tacoma, Puyallup, and Lakewood. And then I retired. When I had kidney failure, I'm going to talk about that. I was on dialysis, so I quit practice after 44 years. So that's my biology bibliography. Okay, now two things I want to really talk fast about, and you need to really understand this. There are two things that are so important. I'm going to tell you why it is. You need to know everything about stem cells, and you need to know about telomeres. Those two are really, really important. And I'm going to tell you, you need to do your research and on these two subject matters. Don't just listen to me. I want you to do your own research and find out the truth. And I use Grok, GROKS, my my source. Grok is a new AI uh, developed by Elon Musk. Fantastic artificial intelligence, and it's only the beginning. I You could get it free, Grok, free. I pay $300, so I get a deeper dive into it. And if you buy the 3,000 one, you get the really deep dive. If you're doing really amazing research and you want to go deep into whatever Library of Congress or whatever you want. So I recommend using your own search engine to find out about these two subjects. Now I'm going to give you very fast things about stem cell that you need to know. In 1978, and most of you guys that are listening to me, I probably don't know about this because you're too young. But in 1978 was the first time sickle cell anemia was cured by stem cells. there are a lot of people in Africa, 1 in 200 that have a sickle cell anemia. And in the United States, is 1 in 300 descendant from Africa that have the sickle cell anemia. And what that is that instead of round red blood cells, you have cells that look really abnormal. They look like sickles that look curved. And so when you have this genetic condition, you will have problems with your health. It will clot. These red cells are fragile. You get anemia. You get blood clots. You feel terrible. In Philadelphia, where I trained, it was people would come into the emergency room, and it would probably every week there would be 2 or 3 people coming into the emergency room with sickle cell anemia, and they call it sick as hell anemia, and that's what it is. You really, really got sick, and in order to treat it, you have to give them blood, you have to hydrate them, and so forth. But it's a terrible condition. The other thing is about telomeres. Telomeres are the ends of chromosomes. When your telomeres get too short, the cell will die, number one, or it becomes senescent cells. Senescent cells are like zombie cells. They don't die, but they cause a lot of harm in you. So look those topics up and check me out. I don't want you believing everything I say. So you need to, I'll lead you. I'll tell you where the research needs to go, and you do it. Okay, so after 1978, stem cells got very important in leukemia and lymphoma. People that fail regular chemotherapy are now given massive amount of chemotherapy to kill off all their cells. And then they're getting infusion of stem cells from the closest relatives they have with the closest amount similar DNA. And they get that transfusion, and it saves about 60% of patients with leukemia and lymphomas. Now, in the present day, it's very important that if you get a sports injury to your shoulder or to your knee, and you will see doctors up here in my area in Seattle, where they'll harvest your own stem cells, either from your bone marrow or from your fat cells, and clean it all up and inject it into wherever your deficiencies are. If you have a torn ligament, torn tendon, or you got hip joint injuries, they can do that. They inject it right in there. They also use plasma-rich platelets, PRP. Those are also a little bit of stem cell, but they're like fertilizer for stem cells to make them grow. And so sometimes they give you both. PRP is paid by insurance. Stem cells are not paid by insurance, and they charge you $6,000 per injection. And you most of the time you need more than one injection. Now, if you really want to get the embryonic ones that President Bush cut out all research into embryonic stem cells, you have to go to Mexico, Panama, or Greece, and they're charging you at least around $100,000 per injection, and they infuse it into your body. The problem is they try to match you up to whatever the stem cells are to your own body, and it's very difficult. That's why it's so costly and very expensive, and it only lasts for about a month. Then you need another shot every month. Okay, nice story, my journey. How much time do I have?
Just keep going.
Okay, my journey. Okay, this is very interesting. I've been on the stem cell kick since I had hypertension. My hypertension, my blood pressure has been sky high. In fact, my blood pressure got so bad that I used to give blood to the blood bank. And when I went in one day, they said, your blood pressure is too high. We can't take your blood pressure. And and it was somewhere around 200 over 110. It was really, really bad. And I've been searching for the cure for my hypertension. And the cure is the stem cells. And I got to give thanks for Tracy, because I've been researching this. And if she didn't tell me about this new treatment, I would have never known, because I go to every anti-aging meeting. I go to A4M, the American Academy for Anti-Aging. I've been going to it every year and listen to all these research that's being done to find the reason why we age. Well, the reason we age is because of two things: inflammation and stem cells. And over time, your stem cells will decrease to a point where at my age, I may only have 5% stem cells. Stem cells are so important that when you were a baby, you're all stem cells. It's healing everything. It's the embryonic stem cells is a little different. Embryonic stem cells are what makes your eyeballs, your brain, your teeth, your hair, and so forth. But then they're transformed into mesenchymal. They're let's say they're adult cells, and that's what keeps you healthy. It keeps repairing your body whenever it breaks down. It heals it. And so you must keep your stem cells as healthy as you can. I talked to my doctor. I want a stem cell injection into my kidney, because I figured if they can inject stem cells into your shoulders and every place else in your body, it would work in my kidney. And I was willing to be a guinea pig, but they said, no, nobody's doing it. But right now in the Mayo Clinic, they started doing stem cell injections in their kidneys. So we're coming around. Stem cells are so important. Okay, now my story. Okay, here's what happened. I've been researching all this stuff, and then Tracy calls me up one day with Sherry Brown, her mother, and they start telling me about this patch. And well, I don't know anything about a patch, and the more she talks about it, about the light, and I thought it was sunlight, and she was telling, no, it's light for your body, and I said, this is really weird. I was really skeptical. I've never heard of it. I've been to every meeting. I'm a doctor. I look for unusual things to help me. So when Tracy told me about it, I said, okay, there are two things I can do to find out this is whatever she's telling me is true, because I hadn't had time to research it. This is so new, but I was very skeptical. But I said, my sister's really sick. She had lymphoma twice. Every time I call her about her health, she's moaning and groaning, saying, I got fibromyalgia, I got tinnitus, I got brain fog, I got restless leg syndrome. I just feel depressed, I'm anxious, and she was in bad shape. I said, okay, Tracy, fix my sister up. And Tracy did that. I called my sister up in 2 weeks. She told me she was better. She never felt so good. And in the meantime, I've been doing research. I looked at what Tracy was telling me about the clinical studies. I got to tell you, the critical clinical study, and you can check me out on this one, is that when you put a patch on, they took 50 patients, put a patch on them, and they drew their blood. And every one of them had increase copper peptides. And that was 30 years ago. No, it's more like probably 60 years ago. Is that right, Tracy?
No, it's actually
Dr.
20
Picard,
years ago.
Dr. Picard was
Yeah. When he
invented.
discovered 50 years
and
ago.
what he was experimenting was with copper peptides on damaged liver cells. And he was able to show that stem cells from copper peptides healed up the liver. But the problem was he never found a way to get the body to get enough copper peptide to do the job. But what he found was if you use copper peptide on your skin, it really helped your skin, and it was anti-aging, got rid of wrinkles. It's better than retinoids and all the other Botox and all that other stuff. And you can look this up on Amazon. There's a ton of cosmetics with copper peptide. And you remember back in the 70s, you were too young, but back in the 70s, women were wearing copper bracelets. Then people were putting copper in their bed. They were using copper, but that doesn't work. You cannot absorb copper, elemental copper in you. So I was so surprised. God, Tracy, I trust because she was my patient. I said, okay, this is it. I said, okay, my sister Betty got better, and she really did get better. And if I can get her on one of these days, you will hear from her how good she feels and what a change she's had. And she used it on our dog that was 15 years old. That dog was crippled. It's amazing. Her story about that dog running around like a puppy is really amazing. So this stuff really works. So I started on my 82nd birthday. Yeah, 83rd birthday. So as I was reading all these studies, what I found was the X39 is really important for stem cells. Eon is really important to cut your inflammation. In my book that I wrote, the handbook on health and longevity, and you can get it, it's a digital form. If you email me or Tracy, you can get a digital copy of what you should eat, how much exercise you need, sleep, and what kind of patching you should do. I wrote this handbook about a month ago with Dina, my daughter-in-law, who is a certified natural nutritionist, and she's a third-year medical student at the Asian Medical School in LA. And she also has a BA in English. She's an amazing woman. She really is. And one of these days, maybe she can come on and talk to you about how she takes care of her patients with these patches. Okay.
We would
so,
love that, Roger.
Yeah, well, there's a lot to talk. How much more minutes do I have?
Oh, keep going. I think let's go till 7:30. So it's 7:06.
Okay. Let me know when I need to stop. Okay, my journey. So I started these patches. At 4 months, all my age spots went away. Those little dark spots that you see, I don't have them anymore. It went away in 4 months. Okay. In 8 months, this is the most amazing thing. My blood pressure went to normal. When I went to see my doctor, and said, when I stand up, I get really dizzy. He took my blood pressure and said, your blood pressure is too low. We got to stop your medicine. So I am now, for the first time in my life, normal blood pressure, on no medication. I tell you, what's happening is that what the stem cells are doing is healing up the endothelium of the blood vessels. See, the doctors don't know this. Your heart doctors don't know this. There are a few of them that do know, and I know a few of them that use the patch in their office, cardiologists, board certified cardiologists, and I have documentation of that. But it heals up the endothelium, the lining, the inside lining of your blood vessels. And what it does, when it heals it up, your lining produces nitric oxide. That the Nobel Prize in medicine was won by that. We're finding out nitric oxide released from the blood vessels. And what it does, it softens up the blood vessel, let it relax. See, when you get high blood pressure, because when your blood vessels get really hard and tight, like a lead pipe, your heart has to really squeeze hard to get that blood through the lead pipe. So my blood vessels were really tight. Of course, with a stressful job that I had, and my mom cooking with margarine, which is another bad thing. We always ate margarine, it clogs you up. You got to watch your diet. But anyway, going on, it got me to the point where I feel great. My regimen now, I'm waiting to see how my kidneys heal. A year ago, my kidney functions were declining because a donated kidney that I have, and that's another story with itself, but a donated kidney, a transplanted kidney only lasts 8 to 10 years. Next month, it's going to be 12 years. And the kidney function tests are getting lower. My creatinine got as high as 2.0, which is really getting bad. The higher it goes, the worse your kidneys are failing, because that's the creatine, that's the protein your kidneys are able to get rid of. So if it accumulates in your blood, your kidneys are not working. So now my kidney functions are slowly getting better. I'm down to what, 1.6, 1.7. Normal is 1.4 or below. So it's starting to work. So I'm on a journey. I don't know. I haven't reached it yet, but I'm telling you, you can watch me. I'll be as transparent as I can, and over time, I can't guarantee that we won't die. Everybody dies, but my motto is, I want to be healthy on the day I die. I don't want to be crippled. I don't want a cane. I don't want to walk. I don't want to be in a wheelchair. And I certainly don't want to be in a nursing home with dementia. So if you believe what I believe in, stay healthy until the day you die. Then you're going to be happy. You got good health. You're happy. You can enjoy life as it should be. Okay, now, once you get the last one point, when you finally get to the point where you're healthy, the 3 patches is the dynamic trio. They have a dynamic tool, but I tell you, there's a dynamic trio. Okay, you need the X39 for the stem cells, you need the Eon for anti-inflammatory, and you need the Alavita, because Alavita it will make your telomeres longer. The longer your telomeres are, the longer you're going to live. And the shorter it gets, that's a bad sign. You're dying slowly. So get your telomeres healthy. And in my handbook, I talk about nutrition, exercise, and sleep. By the way, this watch I have, that's a smart watch. It cost me $99. It tells me how well I sleep. You want your REM sleep to be really as good as it is. Deep sleep, REM sleep is really, really important. That's when your brain is healing. It is clearing out all that debris that's in your brain. So all that fluid, that spinal fluids, removing it. Exercise, number one, is very important, because remember, your lymphatic system does not have a heart. The only thing that moves your lymphatics is your exercise. You must go out there and exercise. Every morning after breakfast, I walk, I jog now 1 mile around the block. So that's my routine. Now, I'm done. Any questions? I want to be challenged. Tell me what you think is wrong. Or question, whatever.
Wow. I have to say, Roger, you look 20 years younger than the day I shared this with you. I'm just sitting here looking at you. Wow. And those brown spots
84.
are all gone.
I compare myself to my contemporaries. Hey, look, my contemporaries are really in bad shape. But I go to the class reunion. I was the only guy out there dancing on a ballroom dance floor. And my wife has passed away. So I took my sister-in-law, who's let's see, she's 65 in a year. So she's 65 now. Anyway, she's younger than I am. We were the only ones out there dancing. I can still dance. Ballroom, country western, line dancing. Sylvia and I did all that kind of stuff in our before she died.
I have a question. But I heard
Yes.
somebody else chime in first. Whoever that was, go ahead. You can go first.
I was asking about the copper peptides.
Yes.
I've been diagnosed with prostate cancer, lymphoma, and lung cancer starting in 2015. Been fighting it ever since. So what would you recommend?
Well, if
you know,
got,
I'm just going to stop right here. We're going to stop the recording. I'm sorry, I failed to do that.
I
You ended
can't-
quicker than I thought
can't-
you would, Roger. But thank
cannot
you
make
so
a
much for being
diagnosis. I'm
here.
not allowed to do that because you're not my patient, and I don't want to get in trouble with your doctor saying something that's different. But I will give you a general answer